There has been an alarming increase in the number of infants being held in a federal immigration detention center, which is poorly equipped to provide adequate medical care to very young children, advocacy groups said in a complaint filed Thursday with the Department of Homeland Security. There were at least 9 infants under the age of 1 detained as of Thursday at the South Texas Family Residential Center in Dilley, Texas, according to the complaint filed by the American Immigration Council, the American Immigration Lawyers Association and the Catholic Legal Immigration Network, Inc. At least one of the infants had been held for more than 20 days, apparently in violation of a court agreement known as the Flores Settlement that says the government cannot hold children in detention centers for more than 20 days. I have never seen so many infants of such tender age held in ICE custody in the Family Detention Center, said Katie Shepard, National Advocacy Counsel at the American Immigration Council. Shepard managed a program that provided pro bono legal assistance to detained migrant families at the Dilley facility in 2015 and 2016. We regularly see babies over the age of 1 year, but it's very rare for us to see infants under 1 year of age, Shepard said. In the past couple of weeks, we noticed an uptick in the number of infants under the age of 12 months held in ICE custody at the Family Detention Center in Dilley. On November 30, 2018, ICE released 60 families, totaling about 130 men, women and children, at Casa de Oración No. 2, a Hispanic church in North Phoenix. Photo, Nicosa, The Republic, on Feb. 22, a woman held at detention center delivered a stillborn baby. The rise in the number of infants being held at Dilley is alarming for a number of reasons, Shepard said, notably because the facility is not equipped to provide specialized care to infants, and the nearest large metropolitan center is an hour away in San Antonio. I would say this is part of a larger trend of this administration utterly disregarding the special needs of vulnerable people, Shepard said, on February 22, a 24-year-old Honduran woman who was 6 months pregnant delivered a stillborn baby after going into premature labor at the Port Isabel Detention Center near Brownsville in South Texas. The delivery of a stillborn baby came after the Trump administration in December 2017 began holding pregnant women in detention centers, ending a policy under the previous administration that they be released. The stillbirth came after 2 children, ages 8 and 7, died while in DHS custody in December. No children had died in DHS custody over the previous decade. A lawsuit has been filed against Dilley related to death of a 21-month-old girl in May. Maria Juarez, a 21-month-old girl who had been detained for 3 weeks at the Dilley Family Detention Center, died 6 weeks after her release. A lawsuit filed Thursday against the city of Eloy in Arizona alleges the girl became sick while being held at the detention center and her condition worsened because of inadequate medical care. The lawsuit contends the death was preventable and Eloy is accountable because, at the time, the city held the contract with ICE that allowed a private company, CoreCivic, to operate the family detention center in Dilley. Thank you. You're almost signed up for AsMemo. Keep an eye out for an email to confirm your newsletter registration. More newsletters. Eloy has since ended the contract with ICE, allowing CoreCivic to operate the Dilley Detention Center, a 2,400-bed facility. Harvey Krause, Eloy's city manager, said he could not comment on pending litigation. ICE says it takes seriously the health, safety and welfare of those in custody. Immigration and Customs Enforcement officials responding to the complaint filed Thursday said the agency takes seriously the health, safety and welfare of people in its custody and spends more than $250 million annually on healthcare services. ICE is committed to ensuring the welfare of all those in the agency's custody, including providing access to necessary and appropriate medical care, the agency said in a statement. Comprehensive medical care is provided to all individuals in ICE custody. More, 28 women may have miscarried in ICE custody over the past 2 years. Staffing includes registered nurses and licensed practical nurses, licensed mental health providers, mid-level providers that include a physician's assistant and nurse practitioner, a physician, dental care, and access to 24-hour emergency care, the statement said. The statement also referred to a June 2017 DHS Inspector General's report that found family detention centers run by ICE are clean, well-organized, and efficiently run, and the agency was found to be addressing the inherent challenges of providing medical care and language services and ensuring the safety of families in detention. The Inspector General's report, however, found that some detainees at two of the facilities raised some concerns about the quality or promptness of medical care. Mothers say babies have lost weight according to the complaint filed Thursday by the American Immigration Council and other organizations. Some of the infants' mothers told lawyers providing pro bono legal services inside the facility that their babies are not feeding well because of abrupt changes in formula. Child health advocates recommend that safely switching formula should be done gradually and monitored by a pediatrician in order to avoid interruptions to the baby's feeding and digestion, something that can't be done in detention, the complaint said. Some mothers have also reported that their babies have lost weight since arriving at the center. Others say their babies are sick or have shown behavior or sleep challenges in detention, the complaint said. We have grave concerns about the lack of specialized medical care available in Dilley for this vulnerable population. Complaint filed by the American Immigration Council. The complaint was filed with the Department of Homeland Security's Office for Civil Rights and Civil Liberties and Inspector General. It demands that the infants and their mothers be released together. We have grave concerns about the lack of specialized medical care available in Dilley for this vulnerable population, the complaint states. ICE has repeatedly demonstrated an inability to meet basic standards of care for minors in the agency's custody, the complaint says. The rise in infants being held there come as the number of migrant families crossing the U.S.-Mexico border has surged in recent months. Since October, Border Patrol apprehensions of parents with children have increased 290% compared to the same period last year to 99,901. During the first 4 months of this fiscal year, family apprehensions have nearly reached the 107,212 apprehended during all 12 months of the previous fiscal year, which set a record. Family apprehensions have increased all along the border, but they have increased 1,588% in the El Paso area, the highest increase of any area. Even if we are seeing more parents with infants presenting at our southern border, it shouldn't change how DHS handles them when they cross the border, Shepard said. They should be released. They shouldn't be transferred to an ICE detention facility. Bottom line, have ideas about immigration or border coverage? Reach the reporter on Twitter or Facebook or at daniel.gonzalez@arizonarepublic.com. Read or share this story, https://www.azcentral.com/story/news/politics/immigrant/2019/02/208/ice-detention-center-holding-high-number-infants-complaint-says/30207350002/.